Welcome to our Moving with MS monthly virtual support group. If you don't know who I am, a special and extra welcome to you. My name is Dr. Gretchen Hawley. I'm a physical therapist and a multiple sclerosis certified specialist, which always is a mouthful to say. But basically what that means is I specialize in helping people with MS learn functional exercises that are backed by neuroplasticity to help you walk better, get stronger, and make your daily activities feel easier, even with MS. There is a specific way to exercise when you have MS, and it's definitely not one size fits all. So I partner with MS Views and News with our supporter, which is Viatris, to share information with you guys that is specific to MS and physical therapy. So what we're going to be talking about today is upper body strengthening, arm strengthening, hand strengthening, you name it. This is something that a lot of people with MS struggle with, especially when it starts to limit us in our daily activities, things like writing, dressing ourselves, maybe buttoning shirts, blow drying or brushing our hair, washing our hair, feeding ourselves, brushing our teeth, things of that sort. As I mentioned, I partner with MS Views and News to bring our Moving with MS support group to you, and our supporter is Viatris. So a huge, huge thank you to them. All right, and our topic today is hand and arm strengthening and a few other helpful tips that I think are important to mention when we're talking about using our hand and arm strength. So we're going to talk about fine and gross motor skills, the differences in strengthening and functional exercise for our upper body, and then what should you do? Because there's going to be a lot of different topics and things that we discuss. So the last thing I want to make sure you have a very clear idea on is what to do, what to implement from all the things that we're going to talk about, and some gadgets and tools that can help as well, and a Q&A throughout, of course. And before we actually get started, type in the questions box if you are someone who experiences some level of any kind of upper body limitations, we'll call it that, whether it's you can't lift your arm overhead as far as you'd like, or your hand is weak, or maybe you drop things, you can't open your hand as much as you want, or close your hand as much as you want, or there's tightness. Doesn't matter what it is. Does anything in your upper body, meaning your arms, your shoulder, elbow, wrist, is there pain, fingers, joints, anything at all that you feel is affecting you? And while I wait for you guys to share your answers, I'm just going to see in the chat, we've got Michael from Fairfax, Virginia. Summer says, yes, upper body weakness. Kimberly says, my arms get tired really fast. Yeah, that's a common one. Rhonda says she has hand weakness and she drops things. Kimberly, when trying to do my hair and buttoning. Yeah, Dion, I'm noticing weakness, my fine motor skills. Yeah, awesome. Okay, I mean, not awesome that you're experiencing that, but awesome in the sense that I've got tools for you and exercises. Julio says the grip strength is not as good as the other hand. Yeah. Okay. Slight hand tremor that I control with lots of repetitions and awareness. Yeah. Kenneth says I drop things. Glad that I have a service dog to bring them back to me. That's great. Pam says arms and hands are numb. Yeah. Okay. So we're going to talk about gross motor versus fine motor skills. So gross motor skills involve large muscles and big movements of the arms and legs. In this presentation today, we're talking more about upper body, so hands and arms. But gross motor skills are often related to big movements, big, like full activities, like brushing our hair is a gross motor activity. Throwing a ball, lifting up the laundry basket, raking or shoveling, bringing a spoon to our mouth. I'm trying to think of other things that we do daily. Making the bed, like the arm movement that we need for making a bed. All of those are gross motor movements, gross motor skills that use our big muscles. Whereas Fine motor skills are the smaller muscles, and it's the ability to control and coordinate those smaller muscles. So this would be things like grasping the hairbrush, whereas the whole activity of brushing the hair is more of a gross motor skill. Grabbing the hairbrush is a fine motor skill. Buttoning, as someone said, buttoning shirts is a fine motor skill. It requires small muscles of our fingers. It's a very specific action. Clasping a necklace, putting earrings in, these small movements are fine motor skills. And fine motor skills really build the foundation for our gross motor skills. And as you can imagine, the gross motor movement of brushing your hair, let's say you have that gross motor movement of your arm lifting and then bending, lifting and bending. That's great, but if you don't have the fine motor skill to hold the brush, that's not going to be that productive. Like, you can do it, but you don't have this hand fine motor strength to complete the action that you're desiring. Similarly, if you are looking to feed yourself, if you're looking to hold the spoon and have the coordination to pick something up with the spoon or fork and bring it to your mouth, you might have the gross motor skills to straighten your arm and bend your arm and do this. But if you don't have the fine motor skills to hold that spoon or fork, to place it and scoop what you want and bring it back to your mouth, it's not going to work as well. It doesn't really matter that you can bend straight in because you can't do the action that you're looking for. So oftentimes, fine motor skills is where we will notice a limitation first because it tends to affect us more. Fine motor skills often require postural control and sensory awareness. So someone mentioned numbness in your hands. If you have numbness in your hands or your feet, that will drastically affect how well you can or can't use that body part, whether it's your foot for walking or your hand for fine motor skills. So we're first going to talk about the postural control. What I want us to do, and if you can, I want you to try this with me. I'm going to back up. So what I want you to try is sit really slouched. So worst posture. And what I want you to do is try to lift one arm, your stronger arm, overhead as high, absolutely as high as you can go. And once you're there, now fix your posture and sit up tall. And can you go even further? Most of the time, the answer is yes, as you just saw. Now, if you want to, don't do it, just watch me this time. So this is my worst posture. I'll show you with my other arm. When I'm slouched like this is as high as I can lift my arm. I cannot go any further. As soon as I sit up, I can go further. All I didn't get more shoulder strength in those few seconds that passed. All I did was I fixed my posture. And that's just a great way to see how our posture actually can affect our shoulder mobility and even our fine motor skills. If we're in slouched posture or we have a really weak core, more often than not, it's going to be harder to use our range of motion. And if that's going to be harder, it can be more fatiguing, and we might not be in the best alignment to use our fingers and hands for fine motor skills. So posture is a big component of using our upper body. So let me go back to sharing my slides so we can move on. I also do see in the chat, Kenneth says, I work on fine motor skills by doing string art at our senior center. I love that. That's such a great idea. And I use weighted utensils to reduce tremors when eating. Yes, weighted utensils, weighted things in general can be great for tremors. Signing paperwork with the name. Yeah, Michael, we'll get into an exercise for that. Postural control. So again, we need to have the ability to maintain good posture, but also change the position of our head and our neck and our core. So again, if we're slouched like this, that changes our trunk or our core, but it also changes my neck, because if I just slouch down, then I'm looking down. If I want to look at you, I need to move my neck. So now my neck is at this position. That also is going to affect how our shoulder moves, how our spine moves. So it's all related. We want to be able to maintain and change our trunk, our core, which would be coming up here, but also our neck, which would mean instead of like this, it comes down and back. It's all connected. The more stable of a posture we have, specifically when sitting, but also standing, the more stable it is, the easier it is to feel like we can use our body more efficiently and effectively. Postural control can often lead to, or let me say, lack of postural control, of being able to change our posture and having strength in our core. Lack of that often can create even more fatigue with mobility and things like transferring and walking, but also with upper body work. So the stronger our core is, the more stable and typically the less fatigue you'll notice when doing any type of movement. Now, the other component was sensory. So basically being able to feel your hands in this case, but this also goes for your feet as well. Body awareness, sensory awareness is understanding where our body parts are in space and what position they are in without visual feedback. The way that we test this in the physical therapy clinic would be, I would have you give me your hand like this. Let's just say this is your hand, and I have you close your eyes. I will move one finger up and I will say, tell me where your middle finger is. Is it up? Is it down? Is it like, where is it? And if you have the appropriate awareness, you'll be able to tell me it's up. Or you might be able to tell me you're pulling it down. If you don't have that awareness, you wouldn't really be able to tell me where it was in space. And we can do the same thing with your toes. Poor awareness, poor body awareness, and this can also be called kinesthesia or proprioception, if you've ever heard those words, that can significantly impact your fine motor skills. So the hand and finger movements that we're talking about. Our brain needs to understand where our limbs are, where our fingers, our digits are in space. So being able to actually feel our hands and knowing where they are in space is imperative. If you're having difficulty feeling your hands, like you have numbness or tingling, burning, pins and needles, one of my favorite exercises, I don't need to move on to that yet. One of my favorite exercises is to get a big Ziploc bag, like a gallon-sized bag, fill it with dried rice, and put your hand in and move your hand all around. You'll be able to feel the sharp edges of the rice, but also the smooth edges of the rice, and it can be a great exercise to get some sensation back in your hand. Okay, so we're going to move on to some exercises that we can do to help with fine motor skills and gross motor skills for upper body, arm and hand strengthening. So core exercises, you're right, we just started with saying core, how important that is. So we're going to do a few examples here, but core strength, one of the best exercises is just practicing posture. Let's not make it any more complicated than we need to. So practice sitting up tall, ideally away from the back of your chair, and just stay here. How long can you stay in this good posture for? Everyone's going to be different. Maybe for you, it's 5 seconds before you start noticing that you're coming back down or you're getting fatigued and you just need to rest. Maybe it's 20 seconds. Maybe it's a minute. Maybe it's 5 minutes. There's no right or wrong. How long can you stay here? This is a great exercise to improve your core strength. Even better if you're squeezing your shoulders back a little bit. That's going to be best for your upper body, for your shoulder blades, and for your neck too. This is an exercise, right? Let's not complicate it. Work smarter, not harder. Stay up here for as long as you can. As soon as you need a break, relax. Stay here for as long as you need. Maybe it's 30 seconds, maybe it's an hour. Whenever you're ready, you sit up again and hold here for as long as you can. It can be really helpful to use your phone, set a reminder, maybe every hour, when that goes off, you just fix your posture, stay here for as long as you can. So you get the idea, but just focusing on best posture is a great exercise. Another exercise that I really like for core strength is, and never do this on a wheeled chair, it's just what I have in my office. You're sitting towards the edge of your chair in your best posture, as you can see, a flat back, and you're going to hinge backwards just a little bit, hold, hold, hold. You should be focusing on your core belly muscles, and then come back up and back. And you're trying to keep your good posture the whole time, and come back up. So this is a great core strengthening exercise that you can do just right from a seated position. You can do it from your couch. You can do it at the edge of a bed. If you're in a non-wheeled chair, maybe like an office chair, kitchen chair, something like that, that's a really great one to implement. Let me get back to my list here. The next one was shoulder mobility and strength. If they sell something on lots of places, I know most on Amazon. It's called over-the-door pulleys, and it's just rope, and each end of the rope has something that you can hold on to, and you put it over your door, and you sit next to your door, hold on to these things, and you pull and pull. So when you're pulling your right hand down, your left hand goes up. When your left hand goes down, your right hand comes up because of the pulley system. And this is a great way to get shoulder range of motion as well as elbow range of motion as well. Another simple thing that we can do for elbow range of motion is just drop your arm down and try to fully straighten your elbow. So often we sit like this or like this, and our elbows are slightly bent. We want full range of motion. So let either one or both arms just fully straighten. How long can you stay here for? And just rest in that elbow extension. Again, it can be one arm at a time or both arms. But that's going to be a great way for elbow range of motion. In terms of elbow strength, it could be something like bending and straightening, with or without holding on to a weight. For upper body strength, we had said the over-the-door pulleys for range of motion, but you could just practice lifting your arms all the way up as high as you can go, and then slowly down. Another one is out to the side and up and slowly down. So I'm just kind of quickly reviewing these. You could do 5 repetitions of each of these or 10 repetitions of each of these. Another one would be a Y. So we've come forward, we've come to the outside, and now this one's halfway in between. So you're at this angle, this Y, up and down. So those are some of my favorite exercises for strengthening our shoulders and our elbows. Another one is coordination. So what I like to do for coordination, and this is classic in the PT world, is you're going to have one hand, doesn't matter which one, you can do both if you want. You're going to take your index finger and you're going to touch your nose, and then you're going to touch something else. In this case, I'm looking down at my keyboard, so I'm going to touch my nose and then the letter B, and then my nose and the letter B. And I'm just going to keep going back and forth to practice this coordination. If that's too challenging, like if you're trying to touch your nose or B and you're kind of all over the place and you can't get it, then the way to get better at this is to be a little bit less specific at first. Instead of my nose and the B, I'm just going to touch somewhere on my face and then somewhere on my keyboard. So it doesn't matter where I land, I'm just trying to get better at just what the object is. And then as I get better, my nose is smaller, the tip of my nose is smaller than my lips. So maybe I would make it a bit easier by saying, okay, I'm going to touch somewhere on my lips. Doesn't matter if I land here or here or here, somewhere on my lips. And then the space bar, which is bigger than the letter B. So somewhere here and then somewhere on my computer. So that's how you can make that exercise a little bit easier. Another option for coordination, tapping fingers to hands. Sorry, not fingers to hands, like thumb to each individual finger. And you can go pinky down to your index finger to your pinky. You could do all together, all open, of course, on both sides. So just different types of coordination for your fingers as well as the finger and arm movement. And then lastly, for upper body is stretching. So when we're talking about stretching, we want to think about what muscles feel tight. And if you don't know, then that's fine. But sometimes when I talk to my patients, they will say, the muscle that feels tight is here. I just feel so much tightness and stiffness on this part of my arm, in which case you might want to stretch it like this. So you're pulling your hand back, or you can put the palm down on the chair that you're sitting on. If your tightness is on the opposite side, then you could pull your hand down or put that part of your hand down. If the tightness is more in your shoulder, then maybe you pull your arm across. If it's more, I'm trying to think of another common area. If it's more in the front, like the pec muscles, you could reach behind you and then turn in the opposite direction. So we're trying to stretch out that front side. So stretching is another type of exercise. When you're stretching, you ideally want to be holding for at least 30 seconds, if not up to a minute or so. And then you'd want to repeat that 2 to 4 times per side. So I'd want to hold about 30 seconds, release, and maybe I do my other side for 30 seconds. That's 1. I would do it again. This is 2. Do it again. That's 2. Do it again. That's 3. So you'd want to repeat 2 to 4 times per side. Okay. Any questions so far? I don't see any coming in. See, Julie joined us from California. Welcome, Julie. All right, so I don't see any other questions. For the finger to thumb, how often would you suggest we do them, and how many intervals? For the finger to thumb, a lot of it's going to depend on fatigue and quality. Quality is the number one thing. Even if you can only do one round, like you start with your thumb and index finger and you go down to your pinky, if after that you're fatigued, stop. Just the one round, just the one time is fine. If you can do more, then I would say the way that I personally would count this is going from my index finger down to my pinky, then back to my index finger is 1. And then do that again, all the way down and back, 2. And I would say, can you do that up to 10 times with good quality? If so, great, that's what I would do. And then I would stop and rest, and then maybe do that one more time. And you'd want to try on the other side as well. But if you can't do 10, that's totally fine. Can you do 5? So that's kind of where I would start, is at 10. And then if that's too hard, do fewer. If that's too easy, go slower, maybe squeeze with each one and do a few more repetitions. So for general exercises or general strengthening, these can also just be helpful. There's something called finger aerobics. And if you Google finger aerobics, there's a PDF that you'll see. And it's things like fingers up and out. And maybe you do this with just your index finger, or you can do it with your whole hand. So all fingers up, all fingers out. It might be out and in, out and in. So it sounds silly, but it's aerobics movements for your fingers. So that's something that can be great for general strengthening. If you have bubble wrap or something that can pop, practicing popping the bubbles, maybe with this grip, but also this grip, play around with the position that your arm is in. When we're doing anything that requires this grip, you'll notice that my palms are facing in. That's going to be very different than if my palms are facing down. That's going to be different too than if my palms are facing up. And you'll find that it's different for everyone, but for some people, palms facing in is easiest. For others, up is easiest. For others, down is easiest. All goes to say, practice all of them. You don't want to only do the position that's easiest for you, because there might be other things in life that you need to be in a different position in. And if you never practice that, you're going to get to that and feel like, oh, I can't do this. This is really weak for me. So bubble wrap, Play-Doh, just kind of rolling it around, playing with it, stretching it, have fun, pretend you're a kid again. Playing with Play-Doh is a great way to strengthen your hand and your grip and fingers. Building Legos is going to be great. My nephew is 4.5, and he's been playing with the log cabin, like the wood pieces. That's great for finger strength and coordination. You have to balance them on each other. Things like that can be really great. Shuffling cards. These are just fun things that can also be exercises for your hands. So now when we're talking about functional exercise, and someone earlier mentioned pen, writing, I don't know if you said writing your name or just writing with a pen was challenging. So when we're talking about functional exercises and what that means for our hands, pick the motions, the movements, the activities that are hard for you to do. And let's just go with the example of holding a pen or writing our name. Break down that movement. So if we're thinking about writing our name, what that requires, I'm going to back up here. We're going to pretend my hand here is a table and my pen is on the table. So if writing is hard for you to do, this requires gross motor skills and fine motor. Gross motor is, do I have the shoulder and elbow and wrist range of motion and strength to lift my arm and bring it to the pen? Then fine motor skills, do I have the hand motion to open my fingers and grab the pen? Okay, so that's two different things. Then let's say I do have that, so I can grab it. Do I then have the fine motor skills to hold on to the pen? Everyone holds on to a pen differently. This is how I hold on to a pen. Do I have the fine motor skills to do this, to get into this position? And then, do I have the strength to keep it there? And then, do I have the ability to write while keeping that without the pen falling loose or my grip getting looser? That's the component. Let me put that over here. Each of those motions need to be strong in order to write. So if of those motions you feel like, yeah, I can get my arm there and I can grab it, but just holding on to the pen is so hard, I can only do half my name before it becomes loose, then practicing squeezing the pen and then relax. And you can't really see this, but I'm squeezing and then relax. And we're trying to strengthen our grip strength in this specific motion of holding this pen. Now, this pen just happens, I did not plan it this way, it is an extremely thin pen. That's going to be really hard. This pen is thicker. Can you see the difference between those two? So it's going to be easier for me to use this pen first. And someone earlier mentioned weighted utensils. You can find weighted pens, but squeeze and close, squeeze and close. If you felt like the part that was really challenging was just grabbing the pen, then practicing picking the pen up and then putting it down as an exercise. So this is what functional exercise means. It's picking the activity that's hard, in this case, writing with a pen, breaking down the steps, and whichever part of those steps are challenging, doing that thing as an exercise. So maybe if it was your gross motor, if just getting your arm there is hard, then this is now an exercise that you're doing. You're not even picking up the pen, but you're practicing your shoulder strength, your elbow and hand strength to get it to the pen and then back down. If it was picking it up, you practice picking it up and down, or getting into the position and down. Okay, hope that makes sense. That's an example of writing our name. If brushing your hair is hard, again, we need our gross motor skills of lifting your arm and getting your hand behind your head and then down. So this could be an exercise that at first glance, if you didn't know what I was doing, you'd think, she looks a little crazy, but this is a phenomenal upper body strengthening exercise to get the strength that you need in your shoulder, in your arm, elbow, wrist, everything to brush your hair. When we're talking about the fine motor skills, I don't have a hairbrush here, but let's pretend I have a hairbrush on the desk in front of me. I would practice squeezing the brush, letting it go, squeezing, letting it go. I would also practice squeezing it in this position, squeeze, let it go, squeeze, let it go. Maybe here, squeeze the brush, let it go, squeeze, let it go. Maybe here, squeeze, let it go, squeeze, let it go. And eventually I would practice grabbing the brush, bringing it up, and down. So I'm squeezing the brush at the same time that I'm bringing my arm up and down. And then can I hold my arm here as I brush, as my elbow bends and straightens? That's a different exercise. So you're picking the components of the movement that's hard and doing those exact things as an exercise. Let's see, I see Julia says, I have a friend and her hands are closed. Yeah, so if your hands are closed, stretching to open them can be really helpful. So I'm trying to figure out what position to hold to show you in. So someone's hand is closed, so opening the fingers as much as you can be a really great exercise. And we're just, by doing this, we're stretching the muscles on the front of the palm, in the front of, on the palm and this side of your fingers. So you're just going to pull those open, pull the thumb open. If they're really closed, then sometimes, first of all, working with an occupational therapist can be really helpful. And what they might suggest is some type of brace that holds your hand open. So if this is a brace, you can have it in your palm and it straps around your arm so that instead of your fingers being here, now they're at that angle. So sometimes bracing is recommended. I can touch my fingers together, but my hand trembles. So trembling is always a little bit tricky because it could be occurring due to weakness or poor endurance, meaning keep practicing that exercise and over time getting stronger and getting better endurance and stamina. But it also could be due to spasticity, or it could be due to misfiring of the neural pathways. Regardless, practicing the exercise is always something that can be done for a symptom like that. It just might be that if that's not enough, if you've been practicing that in the right way for a while, still not much improvement, then maybe it is also caused from spasticity. And maybe stretching needs to be incorporated, or maybe a spasticity medication might be an effective combination with the exercises. That's something that you'd have to determine with an in-person physical therapist and your neurologist. But that's where I would start, is with these exercises. So again, just some other ideas for some finger strengthening exercises might be squeezing a tennis ball or squeezing any type of toy, practicing typing on your computer. This is something I hear pretty frequently from my patients, is that they're typing, but they can't get their finger off of the specific keyboard letter quick enough. So like every time they're typing a G, it's 2 G's instead of 1. Or if they're typing an A, it's 2 A's instead of 1, or a few A's. So practice putting your hands on your keyboard and going down and up, down and up, down and up with whatever finger it is that you have difficulty with. That's an exercise. You don't just have to type when you have to type for work or for fun. Practice it as an exercise. Stenciling can be really great, as we talked about, practicing grasping a pencil or a pen, playing piano. Even if you don't know how to play the piano, just practicing, just playing on the keys can all be really helpful exercises. But one thing that I want to discuss is neuro recovery versus compensation. So with all movements, not just upper body, there's two ways that we can think about it. If we have weakness and we want it to get better so that we can do something, do we, A, exercise to improve the strength, the balance, the coordination, which is everything we've been talking about so far today? What that hinders on is improvements in neuro recovery, strengthening those neural pathways, strengthening those muscles. That is possible, but most of the time, not always, most of the time, it takes a bit of time. At the very least, it might take a week, if not multiple weeks or multiple months, to see improvements. The other side of the equation is, let's not focus on strengthening, but let's compensate. Like, instead of using my right hand that's weak, let me just use my left hand. Or instead of wearing button-up shirts that I like to wear, let me just not wear shirts with buttons because I can't do them anymore. We're compensating in different ways. Or let me just use a mobility aid. or let me just use a tool or a gadget that will help with opening this pill bottle. That's not wrong or right either. They're just two different ways that we can improve things. One is by exercising, one is by compensating, by changing the way that we do something or using something to help. So what do we do? And I often like to share that you can do both. Strengthening can take a while. So in the meantime, you can use tools and strategies to compensate. So that's why I just wanted to share some gadgets that can be helpful. We talked a little bit about the Theraputty or Play-Doh, a stress ball, but there are some tools that we can use for strengthening. And I linked them here. Let me see if this will work for you guys. So Grip Master. Okay, so hopefully you guys can see my Amazon page right now. So this is called the Grip Master. Oh, it's on sale. And as you can see from this photo, this is how you'd hold on to it, and you can press down for each individual finger, or you can squeeze the whole thing down. And each color, you'll see light or extra light is yellow. Extra light is a different color yellow. This is the green one, which is kind of like a middle level. They've got red, they've got blue, they've got black. Each color, and it says it on here, is a different level of resistance. So this is what the Grip Master is. There's also a finger resistance for strengthening, but this is more so, these specific guys down here are more for opening. So the first one was strengthening your grip and closing your hand. This one's for strengthening your grip and opening. And as you can see, let me get it to show. This right here, this one, it's opening. So for anyone who has a hand that's closed, if you have the strength to do so, looping your fingers on here and opening that up can be really great for strengthening the back side. So then gadgets. So these are just for life, right? We can, as I mentioned, we can practice the strengthening exercises to brush our hair, or wash our hair in the shower, or we could get long-handled hairbrush like this. So we don't have to use our shoulder strength at all. We just bend our elbow and we can move it from there. Or we can do both. We can do the strengthening exercises and get a long-handled hairbrush. This picture right here is of the button hook. I can't zoom in. It's kind of hard to see, but there's silver prongs right here, just a single prong, and you just loop it through the button hole, grab the button and pull through, and it makes doing buttons so much easier. So yes, you can practice buttoning as an exercise. That is a phenomenal exercise. Put on a shirt, or at least have a shirt in front of you, and practice looping them on and off. You'll get better at it. But you can also get a button hook so that when you're in the thick of it, if it's the morning and you got to get going, you don't have to try to strengthen and do the buttons at that time. Grab the button hook and you're good to go. Similarly, a raised toilet seat can be helpful. Sock aid or shoehorn, it can be really tricky to put socks on with our hands. So using something like a sock aid can make that helpful. Different pens, utensils, as someone mentioned earlier, anything weighted can help with tremors. Here's a fancy little pen that just allows you to hold on to a pen in a different way. That might provide a better, easier grip for you. A jar opener, pill bottles, so just using different gadgets that can help you in the meantime, so that you are doing the strengthening exercises and you also are using tools to help you and to compensate due to the weakness. Okay, so that's all I've got for you today. If you have any questions, comments, thoughts, I do have an email, my book, podcast, website. I also have a lot of other videos. It's going to let me. If you need more guidance, I've got a Facebook page, YouTube, Instagram, all free content. On my other pages, the podcast. On most places, you can find me as Dr. Gretchen or Dr. Gretchen Hawley, or the missing link, spelled MSING link. I'm a huge visual learner, so I love visual demonstration. So most of the things that I offer, like these, are visual platforms. Trapezius muscles and neck muscles are very sore and tight, like needing a massage. Yeah, so massage is going to be great for any type of muscle tightness, regardless of where it is. Stretching can also be helpful. The thing with neck stretches is that most of the time when we stretch our neck, we overdo it. So a great neck stretch is just letting your ear fall towards your shoulders, like you're trying to listen to your shoulder. But most of the time when we do this, we try to go as far as we can. So we don't just let it drop. We try to go as, like, how far can I get my ear to fall? That's probably going to cause more tension and not actually stretch your neck. So the way to go about properly stretching your neck is to just let whatever natural motion is there occur and not any more than that. So for me, this is how far my neck goes. I'm not trying to actively get it to go as far as I can. This is just where it falls when I try to bend it. And it's probably going to be different to this side. I don't have as much motion over here. That's okay. But this is as far as I can go. You might be able to go further than me or less than me, but you might either feel no stretch or just a very light stretch or a big stretch. Regardless, this is all you want to do. If you feel no stretch at all and you then want more of a stretch, that's when you can, so I'm leaning to my left right now. So my right hand will reach down towards the ground. And I didn't move my neck at all, just reaching down, I feel more of a stretch here. Now we're talking about the trapezius, this can be a good exercise, a good stretch. Another good one is to look diagonally and down. And again, you are not trying to touch your chin to your chest. And how far can you go? No, just how far, if you're just going slowly, where does it feel natural for your chin to fall? For me, it's here. If you don't feel any stretch and you need more of a stretch, as of right now, I'm looking down towards my right hip, meaning I'm stretching the left side of my neck. So I could reach my left hand down closer to the ground to increase that stretch. So just wanted to share that in terms of helpful neck stretches, but also how to actually stretch without overdoing it. A bunch of people saying thank you, you're welcome. Using a towel. I'm not sure what you mean by use a towel. Trapezius neck muscles are sore. I'm not sure. With that said, whether it's using a towel or anything, stretching is so individual. It's so personalized for each person. So anytime I'm working with someone and I've given them a stretch and they repeat it back to me and they'll say, am I doing this right? Or can I use a towel or can I do XYZ? I'll have them do it. And my first question is, where are you feeling it? And if they tell me that they're feeling it in the right place, then my answer is, yes, you're doing it right. Even if it looks funny, even if it's not exactly what I said to do. So then one of the number one things to remember about any stretch that you're doing, upper body or lower body, is to know where you should be feeling it. Because if you know where you should be feeling it, then it doesn't matter if you look funny or not, or if you look like me or not, you're doing it right if you're feeling it in the right area. All right, well, thanks so much for tuning in. Thanks for participating. I always love hearing from you guys while we're live so I can fine tune and tweak my presentation based on what you need. So thanks so much for participating, and I will see you next month. Have a good day, everyone.